Good afternoon. Update on state's efforts to combat COVID-19. Today, I've asked HHS to send the 61 Floridians who are at Dobbins Air Force Reserve Base in Georgia back home to Florida. They were on the Grand Princess off the coast of San Francisco. Many of these Floridians are elderly. They've been it's in a difficult situation for them. So our Department of Health is working with HHS to make sure these individuals get home safely. They will be tested. They will have to do the self-isolation. But I think it's much better for everyone if they can be safely brought back and be able to get back to their homes. As of last evening, we had a number of new cases. If you look, Broward County has the most cases in the state of Florida. The vast majority of those are linked to international travel. However, we have 3 unlinked cases in Broward County. Now that is still being investigated, but in terms of when you have unlinked cases, that is evidence of community spread. But I think the important thing to know is we've been operating under the assumption with everything we're doing with mitigation measures, assuming you were going to see spread in some portion of Florida's communities. So those investigations are ongoing, but we're acting as if that would happen anyways. If you look at what's happening now, I mean, we have had cases in Florida from Egypt. We've had 10 people from Egypt bring COVID-19 in. We've had Iran. We've had all these Ireland. There's a number of students now in Broward from Ireland. Now they're being isolated and everything. So we've had it not just from Asia, but from really all over the world has been brought in. Now we're starting to see it being brought in from other states, primarily New York. So you have a lot of flights back and forth between New York and Fort Lauderdale. People are bringing it in. We're starting to see more cases. I would imagine we're going to see that number grow over the next week or two. So the state's efforts, we're still working to contain anybody who has COVID-19. The contacts are being traced. People are self-isolating. I think it has worked to stop it from spreading as much as it would have, but we've been doing mitigation efforts the entire time, and we'll continue to do it. We are also today, I'm directing Director Moskowitz to move the operations here at the EOC to a level 1. I'm also directing the Department of Health to recruit and hire additional epidemiologists and public health staff from university public health programs and other allied health programs for the duration of the emergency. These folks at the Department of Health have been working around the clock. This is very labor intensive when you're talking about these types of investigations. And so these new hires will assist current operations, but we need this additional assistance because these investigations go on, not just when someone shows up to a county health department, even when samples are being processed by private labs, there are still investigations that happen once those test results come in. So we think that will help with the state's effort to combat further spread of this virus. I also want to just make another point. As you see the Department of Health reporting different infections that happen throughout the state. We're going to continue to obviously do it as timely as we can. But now that you have a wider variety of testing capabilities, if somebody goes into their doctor's office, the doctor takes the sample, sends it to LabCorp. LabCorp is probably going to send a text message to the person. So they may get a text message saying they're positive. Now, LabCorp is required to report that to the Florida Department of Health, but you're probably going to have instances where you'll hear of positives in different parts of the state because it's communication directly from the lab to the person, and there may be a lag time before that gets to the Florida Department of Health. But just understand, we are not, in the state of Florida now, the only game in town. You've got a lot of these you got the 2 big private labs, but then even some of the other labs around the state that are CLIA certified, we're working hard to bring them on board. So the testing is going to be more robust, but it's definitely going to be more decentralized. I'm also directing ACA to extend all existing nursing home and ALF licenses for 90 days. We don't want any distraction from patient care right now, so we're just going to move the bureaucratic hurdles back to hopefully on the other side of this crisis. I'm also directing Director Moskowitz to extend the current visiting restriction for nursing homes, ALFs, and other facilities that cater to the elderly and medically frail to all visitors for the next 30 days. So this is consistent with the guidance just put out by CMS. There will, of course, be exceptions made for compassionate visitation, which is also consistent with CMS's guidance. And ACA is going to be reaching out to all the affected facilities to ensure they have clear direction. At the end of the day, this is a virus that does not threaten all segments of our society equally. The folks who are most at risk for this are folks who are elderly, frail, or have a serious underlying medical condition. So we want to do all we can to prevent this virus from affecting those communities who are most at risk from it. I've also directed the Department of Highway Safety and Motor Vehicles to suspend driver's license renewal requirements for 30 days. We don't want people to have to worry about that right now while they're dealing with the effects of COVID-19. I'm also directing all agencies to suspend state licensing and registration renewal requirements for existing light professional licenses for 30 days. Again, we want people all hands on deck to help. Last night we waived weight restrictions on the highways for supplies that are being brought in. The Department of Emergency Management here under Jared's leadership has done a good job of stockpiling some key supplies. A lot of this is here. Some of it is going to be en route very soon. They've ordered additional swabs. We do have some respirators and ventilators, but we're going to continue to get more of those as this goes on. Gowns, face shields, goggles, gloves, N95 masks, shoe covers, other personal protective equipment, lab test kits, mobile hospital for up to 250 people, and then an ability to acquire services from nurses and physicians in case of a medical surge. So we're on an emergency posture here, have been for some time. We're going to continue working hard. I want to thank Jared for doing this. So the total rundown as of late last night is that we've had 70 Florida residents test positive for COVID-19. 6 of those were diagnosed and isolated outside of Florida. 7 have not been Florida residents. Fatalities have been 3. One of the Florida residents passed away in another state. We've had 478 negative test results, 221 pending test results. And again, those are tests that the Department of Health knows are going on. There's likely many more test results that are pending in the private sector. The department is currently monitoring 365 individuals and has monitored a total of 1,413 individuals to date. We mentioned Broward. Broward, as of late last night, had 24 total confirmed infections. 3 are at this time unlinked, although investigations are ongoing. 11 are relate to international travel. 6 relate to the port with the cruise ships. 1 was a Georgia resident that came from Georgia. 2 had close contacts with the Florida COVID case, and 1 came from a conference in Tampa. So we're obviously looking at that situation. So we're going to continue to work hard. I think the message is particularly for folks who are elderly, who are frail, or who have a significant underlying medical condition is just avoid crowds. I mean, I think that's the number one thing if you're in that danger zone, avoiding crowds. I know CMS's guidance, so we've put out guidance about limiting these big events. CDC recommends 250 people or under only. But I would just say, if you're someone in that vulnerable population, just steer clear of crowds entirely for the time being, because that's where probably you're going to be most at risk. So I think a lot of the efforts that you're seeing in the private sector, I mean, we've got Publix is working hard. I mean, they've got all kind of demand. People are stocking up. You have different businesses. Some of the hospitals are working round the clock. They were doing a really good job. So people are really engaged in this, and I have no doubt we're going to get through this. But we want to get through it in a way where we can minimize the harm to our vulnerable populations. And so even if you're somebody that's not at risk to really suffer anything serious with this virus, by you doing your part and helping with hygiene, social distancing, and the like, you're doing your part to help slow the spread of this virus and probably save people's lives. With that, we'll hear from some of our folks who are helping to lead the fight, and we'll start with our Surgeon General.
Thank you, Governor. Good afternoon, everybody. First, I want to thank Governor DeSantis, Lieutenant Governor Nunes for their tremendous leadership in this incredible activity. Also, want to acknowledge the support of my fellow agency heads. I wish to emphasize that this is an all-hands-on-deck response with a massive coordinated response among different state agencies. As we've talked about before, this is a virus spread person to person by respiratory transmission. Symptoms: fever, dry cough, and feeling tired. As the governor mentioned, nearly all cases of COVID-19 we have in Florida can be tied to another individual with COVID-19 or an individual who has traveled here from overseas. As the governor mentioned, we are also now starting to see individuals with COVID-19 who've come here domestically, and this reflects individuals from New York and some other states. If you have traveled to Florida from an international destination or from one of the hotspots in the United States, when you get here or have been here for the past 14 days, we ask you to avoid being in the public, avoid the elderly, watch for your symptoms for 14 days, and if you become ill, self-isolate at that point. We have to emphasize that everybody needs to continue to protect yourself. Avoid being around people who are ill. If you're sick, don't go to work. And always be sure to wash your hands frequently. Practice social distancing, which means when you're in lines with other people in other situations, try to give yourself 3 to 6 feet between the person next to you. And as the governor mentioned, if you want to avoid getting COVID, avoid crowds. Thank you.
Jared, want to do an update on EOC?
Governor, Doctor, thank you. At the governor's direction, from here we'll go to a level 1 at the EOC. As the governor said, we have been ordering all sorts of PPE and equipment that would be needed. We've been doing that now for some time, and we've continued to plus up the amount of orders. We are ready to do a med surge into a hospital if we have to. We've been coordinating with the Guard on their available medics. The governor outlined all of the different resources that we've been ordering. We also, as he announced just the other day, we went out on the commercial market and purchased actual test kits to make sure that we did not have a capacity issue. And we don't. We don't have a testing capacity issue as far as kits in the state of Florida. Just based on the purchases that we've made on behalf of the governor's direction, we could accommodate up to 625,000 people when all of the kits arrived. From the beginning of this issue, when the governor instructed me to activate, we've been working on contingency plans around our comprehensive emergency management plan here in the state of Florida. And while we've been doing containment, we have also been preparing for mitigation measures. And we've been working with other state agencies and partners on that. And I just want to thank the Department of Education, ACA, Corrections, the National Guard, and the Secretary of State, and all the other agency heads and agencies who have been participating in this. Obviously, the Department of Health with the one leading the health response to COVID-19. Let me be clear, we are not waiting for the situation on the ground to dictate response. We are doing things before that is necessary. And so I want to thank the private sector, who I've been in touch with several times. They have been willing to work with us, closing mass gatherings, doing the things that are necessary in order to protect people of all ages, but especially the elderly. I've been in touch with Publix and Walmart and Amazon. We are not seeing supply issues. Yes, if you go to the store, antibacterial toilet paper are hard to get, but unlike in a hurricane where we're not going to be able to resupply right away, resupply is not an issue. There are no supply chain issues at this time. We are talking to them about contingency plans if workforce issues become a problem. Please get supplies. Lots of people are going out getting supplies. Continue to do that. That's just good planning. Make sure that you have supplies, that you have food and you have water in your house. Go do that now. Additional mitigation measures may need to be taken in the future as we hit different steps. And so I want everyone to understand, while these are clearly inconvenient as we do these mitigation measures, they're important for life safety issues. That's why we're doing these things at the nursing homes. I understand that we may have grandchildren that want to visit their grandparents, but it's important to do these things in the nursing homes. These are lessons learned as myself and in coordination, communication with different National Guards and other state and different emergency managers for figuring out what's best practices and what lessons learned exist out there from other states that we're slightly ahead of where the state of Florida is. So we will get through this, and the Division of Emergency Management is prepared to respond, and we look forward to working with our other state agencies. Thank you.
Mary?
Good afternoon. Thank you, Governor, for your leadership, Surgeon General Rifkes, Director Moskowitz. It is incredibly important to stress that aggressive intervention, which includes all of the initiatives that are underway in Florida, is containment. We cannot say enough the risk that exists for our elderly and those with underlying medical conditions. This infection is highly transmissible, and for those over the age of 70 in our nursing facilities, in our assisted living facilities, and other residential programs, it can be highly deadly. That is why we are taking the steps that we are. To the family members, this is being done because of our love and compassion and concern. We are taking every step possible to protect our most vulnerable. We have been working closely throughout the state with our hospitals and nursing facilities and assisted living facilities. We are working with them to ensure constructive collaboration at the regional level. Now is no time for individuals to be angry and frustrated about what patient gets transferred and what patient gets admitted. We need to be supporting hospitals and nursing facilities so that they can fulfill their role. We know that for many nursing homes and assisted living facilities, they do not have negative pressure rooms. They do not have skilled staff ready to use N95 masks. That is above and beyond what is today expected of them for infection prevention. They are working and need to work closely with hospitals and other facilities that do have negative pressure rooms and N95 masks and other facilities to ensure containment. We can't let this infection into a facility for our elderly, into our long-term care residential programs. We have been working and looking at ways in which, through the governor's emergency order, to support hospitals that may need to stand up space that has been vacant or to use buildings that have been previously licensed for inpatient use, to expedite that process. Additionally, under the President's federal declaration, there are more flexibilities that the state now can use for the Medicaid program and for our regulatory program. So this means getting rid of prior authorization, allowing individuals to get more medications, and for individuals who need support at home, allowing family members to support them at home. So we are working closely with the Department of Elder Affairs because we know that there could be workforce shortages for those who need care in their homes. We are looking at all of the contingency plans that exist today, from emergency preparedness to support those services and supports being delivered into individuals' homes. We have to remain vigilant, and the leadership at the state level is helping to support the aggressive containment of COVID-19. Thank you.
Secretary Lee.
Voting is underway for Tuesday's presidential preference primary. Under Florida law, voters have several options under which they may cast their ballots. Early voting is still going on, as is vote by mail, and of course there is voting available on Election Day. Earlier this week, we announced that precinct locations that were located at assisted living facilities and other facilities housing our most vulnerable would be closed to the outside community. This has resulted in some changes to local voting precincts, which are being managed by the supervisors of elections in each of Florida's counties. The Department of State is in constant communication with the supervisors of election to ensure that we are aware of any changes that are occurring and that they are receiving any support that they might need from the state. Voters who are interested in determining where their precinct is located or any other information about Election Day should check their local supervisor of elections website. That is and has always been the best source of information for the very most up-to-date information for Florida voters. Voters who have questions about options for voting or how they may cast their ballot can contact our voter assistance hotline at the Department of State, which will remain open from now through the close of the polls on Tuesday. That voter assistance hotline number is 1-866-308-6739.
Thanks. And I just want to again thank a lot of the folks throughout the state. I mean, the nursing home folks have been working really hard. Our medical professionals, different private businesses. The response that folks have done, has involved a lot of hard work. And so we, on behalf of the state, certainly appreciate all they've done. And I also want to thank the legislature for powering through. I think they're going to lay the budget out tomorrow. I think there's going to be a lot of good things to come out of this session. It's not something that we've been focused on as much in the last couple weeks, just because of this virus issue. But there's a lot of important stuff that's been done on behalf of the people of Florida. And so I think that by and large, I think they're going to have done a really good job this session. I think we're going to have a lot of wins for the people of Florida. With that, happy to take a few questions.
You refer to Florida as low risk. What do you consider us now?
I think that's based on how the CDC guidance is. I think they still say the country is overall at low risk, and obviously your an individual's chance of being negatively impacted is still in the state of 21.5 million people, low. At the same time, we're taking measures to be able to keep this a manageable situation. And if you don't do anything and you leave everything unchecked, then those infections will continue to spike. What we're going to see, I think, over the immediate term is, you're going to see more infections because a lot of this stuff is going to trace back a week, 10 days. Some of these social distancing measures, I think, are going to help to flatten the curve. And then I think some of the other measures that we've done will help contribute. And then I think individuals have changed behavior as well. So it's an ongoing situation. People just need to be smart in terms of how they're behaving. But from a percentage perspective, your chance as a Floridian, particularly if you're not in a frail or vulnerable population, of being negatively impacted, this is still very small. But you could acquire this, have no real negative impacts on you personally, but then could be involved in transmitting it to someone where it really would be serious. And there's no question for senior citizens and for medically vulnerable people, this is much, much more deadly than just a seasonal flu. I mean, if you look at the numbers of folks who acquire it, particularly once you get to be 75, 80 years old, it's a pretty high percentage. I mean, I think Italy is close to 20% of folks suffer fatalities when they're in that age group, and so it's something we've said from the beginning, all the way back in January when we were dealing with it. I mean, it's certainly a serious threat, but it's a serious threat to a certain subset of the population.
Can you talk about the community containment issue? Can you give us more information? You said a couple days ago that was not an issue. What changed to reach this point? And then what communities?
Community containment?
I'm sorry, transmission, community spread.
Well, first, I've actually never said it's not an issue. What I said is they do investigations, they document the different contacts, and at that point, by a few days ago, they had been able to link ones. But I've always said there's people out there, because the symptoms are so mild for younger people, of course we could never be sure who may transmit it. We know who's presenting with symptoms. We know that. The posture we've had has assumed that you would have transmission in the community. Whether that's ultimately validated when they finish these investigations, these 3 links cases, we're still going forward as if there are pockets in the community, because I think that's the only responsible thing to do. When you have a virus that is highly contagious, that's the right posture to be in. So that's been our posture from the beginning, and I'll let the epidemiologists make the determination once they have a sufficient number of unlinked cases. But we've always assumed that this was something we're going to have to deal with.
Now that epidemiologist, Governor,
have you been able to establish a timeline of? I mean, with the hurricane, we know when the storm's coming, we know it's going to hit, we know when we go into recovery mode. This is a bit different. I mean, is there any way to establish a timeline to this, or is it just basically bracing?
I would defer to people like Dr. Fauci. I think Dr. Fauci has said nationwide you're looking at 6 to 8 weeks of where we're really going to be having to dig in here. But I think it's dynamic, and I think the more success you have up front, probably maybe the less time it'll end up being in this. But it's an evolving situation. I would say cutting off the flights from Europe and then adding Ireland and Great Britain, I think, is a benefit right now for Florida, because we had a number of cases from Ireland recently, and to not have it being brought in, it's one thing to guard against its spread, and if you have a pocket of community spread, surging resources there or taking other mitigation measures there. When we constantly have it being brought in, it makes it more difficult, and so I'm glad that the president did that. I think the administration needs to look at domestic flights from certain areas where you have outbreaks. And obviously that involves a lot of things with the economy and everything, but I just think what we're seeing here is we're seeing cases now where people clearly would have acquired it somewhere else in the United States, brought it here. And I think New York, given Florida's relationship with people and our population's relationship to people from New York, you just have a lot of interaction. And so the question is, if these measures are succeeding, but then you still have more being brought in, it just makes it much more difficult to be able to contain it.
Does that also follow for the people? There are at least 3 cases we know of where the people's only travel was to Florida.
What do you? So you're saying?
So that they may have had acquired the disease here before they went the virus.
I'll let
Florida.
Scott. I mean, do you know? Are you keeping up with those? So those are other states' cases. You're saying?
They're in other states.
You want to address that, or do you know those cases?
Yeah, and we're currently waiting information from these other states about additional information about that.
So Governor, what authority do you have in restricting people from outside coming to the state? And also, what authority do you have in restricting group gatherings? And when will you use that authority, if you do have that authority, to begin, mandating that gatherings larger than 250 or whatever number you want to choose?
So I think on the latter, I think basically our approach has been to be collaborative and work with different localities, private organizations who may be doing big events. So, for example, the PGA Tour had a big tournament up in Northeast Florida. I spoke with the commissioner let them know where we're at on these large gatherings. You know, they obviously made a swift decision on not allowing that to continue with the large crowds. So I think it's going to be more collaborative, and I think that's better to do it that way. But my sense has been most people want to do the right thing. I mean, we're not getting really a lot of blowback when we're putting out guidance with respect to the large crowds, because I think people get it, that if you take some of these measures now and you're doing it in a way that's calm and reasonable and sensible, then we have a better opportunity to get back to normal. In terms of prohibiting people coming into the state, I think I have probably very limited powers to do that. I mean, quite frankly, we're a federal system. We're a country. People come in. I'll have people tell me just in normal course of business, hey, we have all these people moving in. Do we have too many people moving in the state? I can't really prevent that. So I know we're speaking with the administration. We are concerned about the domestic flights, but at the end of the day, someone wants to get in their car and come to Florida. It's going to be hard for us, to seal off the state from other states in the United States. That's just the nature of how the country works.
One more question about the Department of Health staff and epidemiologists. I'm curious when you think you're going to be hiring more staff. How much money are you going to dedicate to that staff? And
so I'll let the Surgeon General do it. I mean, we've basically said go do it with these public health programs, and we want to plus up. So.
Yeah, thank you. We have a number of schools of public health within the state, and actually earlier today we had a call with their leadership asking them to join us in this important fight. Thank you.
do you have an idea, though, like how much you want to increase that staff load by, given it seemed to be a priority? So I'm curious, how many do we have now and what you want to increase it to?
Yeah, so we asked them to put together plans where the different schools of public health will actually have teams which will be able to work with us in our particular areas where we need additional epi support. Thank you.
Thanks.
No idea of a general number of